So I'm very excited to introduce Tim. Tim Dietrich is a director of sustainability, the sustainability team at Hamilton Health Sciences and the project lead for HHS's Strategic Performance Collaborative. Tim has applied skills in quality improvement, Lean and Six Sigma, advanced analytics, and project management. He is also a sessional lecturer at the Faculty of Engineering at McMaster. He is certified by the American Society for Quality as a Six Sigma Black Belt in Quality Engineer, and he has been a student practitioner and mentor in quality improvement for over 22 years, both in manufacturing and healthcare organizations. He's also occasionally my boss and an overall amazing person. So I am so excited for this talk, and you guys are in for a real treat. So take it away, Tim.
Thanks very much, Claire, particularly for your kind words. Here today to talk about data collection and then data visualization. Just going to state my conflicts of interest. Essentially, I have none other than my employment with both Hamilton Health Sciences and McMaster University's Faculty of Engineering. The objectives were laid out on the website already earlier, so I won't spend a lot of time other than, I'm going to focus on how we can minimize rework and data collection. I'll talk about tips in collecting data, and then quite a few slides on visualizing data. So hope I can fit everything in. I know my feedback today will be that I probably had too much slides. So I just want to remind everyone about data collection and the misnomer that, data isn't necessarily information. What it is a set of facts about the process under study. And we use data to generate information. So it needs data, but data doesn't necessarily include information. So trying to make that distinction quite clear. As quality improvement practitioners, we need answers to questions. Which means we need information to do that. We often talk about the need for data, but it's really the need for information that's important. And so quality improvement, process improvement is an information-intensive activity. We need to be able to understand both the problem at hand, the causes to that problem, and then essentially, knowing whether the change we made resulted in an improvement. And so there are different stages when information needs are greatest, both in the early stages of a project where we're defining the problem and probably creating a baseline of the outcome measure of interest. So this helps us answer the question, like, how often does the problem occur? Where does it occur? And then as we move to the theory generating portion of a quality improvement project, where we are looking at symptoms, analyzing those symptoms, generating theories about what might be causing that and the problem, organizing them logically in a root cause analysis diagram or network diagram, and then testing those theories. So data collection here is generating information to help us understand what's causing the problem. And this, is what Dr. Duran refers to as the diagnostic journey in a quality improvement project. It's helping us diagnose the root cause or causes of the outcome measure and why we have a problem in the first place. And then as we move through what Duran would call the remedial journey then, is really understanding, what changes we need to make, how we address cultural resistance to that change. Essentially, after implementation, we need to know whether that change we made resulted in an improvement. So it's kind of the three major stages in which we would see information needs being the greatest. In the problem definition stage, in the diagnostic stage of the improvement project, and then in the remedial stage as well. And so, using those three different categories, the first one really around how often does a problem occur, our quality improvement toolkit, the run chart is most helpful here. It helps us to look at our baseline performance and understand what the historical variation is in our particular outcome measure. For example, here's daily urine cultures from an urgent care center. And there's only 10 days worth of data here, but quite quickly you can see how limited there is in terms of the amount of variability. Really bounces somewhere between 14 and 20 daily cultures. And so this is going to help us also in the third step when we're trying to see whether a change we made resulted in an improvement. But this essentially sets our baseline for a problem and helps us know how often it's occurring. It takes out subjective views of how often a problem is occurring, puts it in a more objective fashion, and lays it out over time. That second set of information needs in the quality improvement project, where I talked about the diagnostic journey, and we're trying to understand the cause of the problem. We use other quality improvement tools as well in this step. And when I think about diagnosing root causes, there's two major ways we can do that. We're always trying to find patterns in our data. So we use our knowledge about the process, but then we have to inform that with data. And the two best ways to do that is trying to find a pattern related to time, which we can use our baseline data set for. So if we saw a sporadic spike here, for example, that's much, much different than the historical running record. That generates a theory that something happened at that moment in time that's worth digging into. And because it far exceeds the variation we've seen in the past. And so that's almost an easier diagnosis, because you can narrow in or hone in on that particular data point. And in this case, it would be on a particular day. Depending on your time scale, it might be rolled up to a week or possibly even a month. But it helps to generate potential theories for root cause, because you've got essentially the sporadic spike or special cause, which isn't really part of today's talk, but at QI theory. The second is looking for patterns that are not related to time. So again, we use the run chart for patterns related to time. We use other QI tools to look for patterns that aren't related to time, such as stratification, Pareto plots. Here's a Pareto chart for a massive transfusion protocol and the reasons why there were long delays in getting the initial blood product. And so, and to tie it to today's theme, I would say, Pareto plot is one of the major QI tools to detect inequity, right? So as we stratify the data by the various variables you've got, the null hypothesis is that those bars should be flat, right? Because that would suggest that there's no contribution for that particular variable in terms of the defects or problem that we're seeing. Whereas if we see the Pareto principle apply, such as in this example, it suggests there's then inequity, and therefore focusing on the top bars helps us make major changes to the outcome variable with focused effort. And of course, the traditional scatter plot, another QI tool that helps us diagnose potential causes or root causes to our problems. So where our independent variable is our theory of interest, our variable we are investigating, and then our y-axis being our outcome measure. We can start again to generate theories because we see this pattern between X and Y. It's obviously unrelated to time. And then in that third example that I outlined at the beginning, where else our information needs are great, is after we've made that change. And the quicker we can get information and feedback about the change we made to see whether it resulted in an improvement, the better. And so just going back to that simple example that's out there on the internet is looking at the urine cultures from the urgent care center, and a process change was made at a particular day. And you can see right away, this is an example that clearly shows a reduction in the number of cultures sent from the urgent care center. So the process change made there obviously had a significant impact to the outcome measure of interest in this case, which was urgent urine cultures being sent from urgent care. And we see that obviously because of the pattern of variation is significantly different from the historical running record prior to the process change. And on a statistical basis, we have this run of at least 8 points below the historical median performance. And so very, very quickly, we get feedback to say, yeah, the change we're making has resulted in improvement. This becomes our new baseline performance. And the next question becomes, are there other causes at play that we can try to address with interventions and changes? And so we'd want to try to move that even further. So, quality improvement, when you think about, even Dr. Karan this morning talking about taking the time to step back, that's what quality improvement is, right? It's taking time to work on how we work, right? So it's working on the process rather than working in the process. And so being able to now step back and say what other causes might be leading to this new baseline level of performance, and continuous improvement is always trying to drive that mean down when down is better and up when up is better. So I like this little visual because it's obviously going to get us to our first learning objective. But as I said earlier, in quality improvement, we have information needs. We often translate that as data needs, but essentially we have information needs. And so if we're planning for data collection, like data collection is a process. It helps our teams answer not only the right question and generating useful information to answer one of those three broad questions I talked about at the beginning, but also helps us to avoid rework if we follow a model such as the one I've laid on the left, where we have a question to answer because that's going to satisfy some sort of information need. We collect data to answer that question, we analyze it, and then we reflect on that analysis and communicate it to our QI team, our frontline team members, our patients and families. And essentially, this is an iterative process where we just now have another question to answer. But what's helpful in data collection is, and to help avoid rework, in other words, collecting data, realizing you either forgot a variable to collect or it's of low quality, is to start with the end in mind. And so if we're trying to generate useful information, then we want to proceed kind of along the following lines. So what question do we need to answer? So it might be, what are the major contributors to our problem? It may be about whether, a particular variable is a potential root cause to our problem, but we're trying to generate information to answer a particular question. And so starting with the end in mind, we actually go backwards. We don't jump to data, we jump backwards to communication. We say, okay, well, how will we recognize and communicate the answer to that question? And knowing that, it tells us what analysis tool, such as a Pareto chart or a scatter diagram, might we envision using? And then how will we communicate those results? Knowing the analysis tool we're going to be using helps us move to the data that we need in order to construct that tool. And then now that we know the data that we need, we can start asking more detailed questions like, where in the process can we get this data? Who in the process can give us this data? How can we collect this data from these people with minimum effort and chance of error? And then what additional information might we need for future analysis? In other words, maybe we want to stratify the data by multiple variables. And so it's helpful to think about that ahead of time before collecting the data so that you're not going back again to collect another set just so you can collect that additional data point. And obviously, you can hear me talking more about data that we need to collect kind of by hand or manually, where we're asking team members to collect it because it's not data that we have. This model is also quite helpful for our decision support colleagues in large organizations where you have databases to query, et cetera. If you work with them quite closely, they're very good at this model because they don't want to be asked, to provide data. They want to be included up front, saying, what question are you trying to answer? Tell me what you're trying to do. And they can help guide you to determine what data might be best. And they'll think about things that you might not. So having a thought partner around, particularly if you're querying data that already exists and you need some expertise with that, those folks are quite good at this model. And are very astute at asking these types of questions and working backwards to make sure that the data they give you is going to be useful for you in your quality improvement project. And so, as I mentioned earlier, like data collection is a process. And so how do we collect data? This is, looks to be a complex process. It's not meant to be like, a Rube Goldberg process where it's, unnecessary computation or unnecessary work in order to achieve the result. But it certainly is a good guide, especially if you're collecting data and asking others to collect that data for you, particularly like collecting data by hand or manually. We talked already about this upfront part around formulating good questions, what data analysis tools we're going to use. But it's also helpful to think about like where in the process are we going to collect the data? Who's going to collect it? And you see the term, unbiased here. Like when we're collecting data, one of my mentors, a VP here, Dr. Ralph Meyer, always talks about, when we're looking at data, it's either telling us the truth, or it's, just chance. The variation that we're seeing is just due to chance, or it's due to bias. And so there's many points of bias in data collection, but at the point of data collection in manual data is one of the greatest ways of bias can be introduced. And so selecting an unbiased collector is going to be important. And what environment are they working in? Do they have the time and ability to do this? You certainly don't want people just filling in data at the end of their shift because the quality could be quite low. create a simple data collection form, whether that's, again, paper-based or whether it's spreadsheet-based or it's inputted right into the health record. Creating instructions like standard work, and then testing the forms and instructions can be quite a useful step because it's really it's a mini PDSA, right? Plan the data collection, do the data collection in a small scale, study what you learned from that data collection, and then adapt the data collection form again before you go out and collect data in a mass amount. And then training the data collectors, obviously, and auditing that process is kind of the study and act portion in the long run. So it is a process. It looks complex, but it's not meant to be. And so I'm just going to quickly walk through a simple example about how we use this, in a particular problem. We were trying to answer a question in an improvement project around general surgical residents and the tasks that they were performing. So one of the questions that came out of that project was, what tasks performed by these residents are unnecessary and which ones are occurring most often? And so those were the questions we were trying to answer. And so we felt that the most appropriate analysis tool for this was either a Pareto chart or just a simple bar chart showing those dominant tasks and their frequency. We determined that the best place to collect the data collection was at the point that the resident was paged or where there was, say, a direct conversation with someone asking for a task to be completed. Ideally, we wanted to select an unbiased collector, but technically this wasn't done. We didn't have anyone shadowing the resident who could collect the data. It was the resident collecting the data themselves. So someone could argue that they have a bias, but we were unable to address that piece. Understanding the collectors and their environments, we did have someone shadow a resident just to determine how we might collect the data. But essentially that helped us understand kind of what questions they're asked, so it helped us to design the data collection form. And I've got that piece of it on the next slide I'll talk to in a minute, which was version 1. And then we didn't create standard work because the residents collecting the data were part of our QI meetings. And so it was really just done verbally during the meetings. Testing that form, again, as I said, it can be a valuable step, and it was valuable in this simple example as we adjusted the form to a second version prior to going out and collecting more data. And so I'll kind of just show you an example. This is a snippet of the data collection form they were using. And it's not really important with the details, where the point was we tested that form and then adapted it based on what we learned. So we tried to make it a little bit easier for the data collection to occur. And we got information needs that we didn't collect in the little test because we realized it may not give us what we needed to answer our questions. And so we did some simple things around making it a little bit easier to circle, where the request was coming from, what activity might have been required. And then we even had a third version of this where you see we have priority key here, and then we made them kind of circle the question. But as a data recorder, you're flipping back and forth between the priority key and the priority numbers. So we ended up just putting obviously high, medium, and low in the third version in this column. But just the point of this was really just showing that small PDSA on the data collection form helped us improve it. And then we ended up collecting the data. I've anonymized it just to protect the innocent, and created the Pareto chart. And so very quickly then we can now answer the question, what tasks performed by general surgical residents are unnecessary and which are occurring most often? And in this small subset of data, we can answer that question saying, certainly task 5, 3, and 7 are dominant, but certainly, tasks 1 and 4 are useful to understand. And so that's a very quick example of this, 10-step data collection process that probably is more handy if you are collecting data by hand, asking team members, nurses, business clerks, other interprofessional team members to be collecting data. It'll help you avoid rework. And so those are also a few little tips and tricks around data collection. The second part of the talk is tips around visualizing data. And I've repurposed some slides that I've used in a previous talk. So for those who have seen this before, I apologize, but there are some useful tips here. And there's quite a few slides, but it's a lot of visualizations. So I'm going to be going through them somewhat quickly. Sally Bigwood once wrote that after years of hard thinking, I have concluded that graphs are like jokes. If you have to explain them, they have failed. And so the tips today on visualization data are going to really follow that thread around we can collect data, but it's the analysis of the data and how we choose to display that data that's going to lead us to conclusions about that data, and is going to help us answer the question, right, in that circular process I described before. And so visualization of data is just as important as data collection, both in terms of minimizing bias, understanding the difference between truth and chance, and making sure that we're, as a QI team, we're making the right decisions. And so, one of the most important questions we answer up front is, should I just be displaying this data in a table, or should I be using some sort of a graph? And the general guidance on this is, if it's important enough to know the specific data points, like you actually need to look up a value, then presentation of data in a table is going to be most effective visualization for that particular data set. So we may need to compare individual values. We might need to express a value precisely. It's also helpful if you have so few data points, a graph really doesn't make sense. And a good example of that is if you ever see a pie chart with only 2 data points, it looks like Pac-Man, right? It's like most of the data, is the head, and then the other data is that little triangular slice. So it looks like Pac-Man. There's only 2 data points in that. So a graph probably isn't the best way to describe or display that data. A simple table of values, because there's only 2, would make the most sense in that scenario. A graph works best when the message is contained kind of in the shape of the data, the location and the shape of the data, i.e. the distribution. So sometimes we need to detect patterns. So a Pareto chart is a good example of trying to detect a pattern where there may be inequity in the way we're delivering care or service, or there's a particular causal system acting on our process, and we find that most of the problems or defects are coming from a particular category. If we're trying to understand relationships, so whether there's a correlation, say, between a particular variable in our process and the outcome of interest. If we're trying to understand trends through the use of a run chart or a time series plot, a graph obviously works best if we're trying to say, hey, there's been a change over time. And exceptions, an example I was describing earlier, which was that sporadic spike, right? Those are exceptions to the norm, right? We have a historical running record of data. If we see a sporadic spike that far exceeds the amount of variation we've seen in the past, that's an exception. And a graph works best at detecting that. And all of these are much easier to detect if you have a large data set. So obviously, the larger the data set, the more important a graph is to understand patterns, relationships, trends, and exceptions. And so, assuming that you want to now select a graph, the next question becomes, which one do I use? And there's a good article out there by Stephen Few, published probably 2008, 2009, just describing the different types of quantitative relationships and how to display them. So you may be ranking, such as in a Pareto plot, maybe looking at a deviation from a particular norm, a bar plot, a correlation, which is best done with a scatter plot, time series, so our run charts, our control charts, part to whole, which says, what proportion comes from a particular category. And it's important to note that this is not a pie chart, but rather a bar chart. The distribution, as I described, so box and whisker plots, histograms, all of these QI tools that we use every day, all trying to answer and address these different categories here. And so these are really the only types of relationships we need to uncover in a quality improvement project. And there's some guidelines on how to describe that. And Cleveland in 1994 did some interesting research around how we as humans kind of process information, and depending on the nature of the display, how best that information transfers to us. And the research there discovered that things like position along a common scale or position along a non-aligned axis, such as what you would see in a bar chart, a time series plot, a scatter plot, side-by-side graphs, reflect the best information transfer. And when we try to encode data through angles or slopes or areas or volumes, we have the worst information transfer. And so down here, you see things like pie charts, stacked bar charts, those and 3D plots obviously the effectiveness of those graphics starts to decrease significantly as you move down the axis in the lower direction. And so we're trying to select display tools that come from the top of this hierarchy. And in Microsoft Excel, there's a whole bunch of choices for you to pick from, but really only 6 of them are needed, particularly for quality improvement, to display those types of comparisons that Stephen Few describes. So there's a lot of what probably would be called junk chart in the literature that some of your simple analysis tools can use. They might look nice and fancy, but the information transfer is going to be poor. And so I'm going to quickly run through an example around pie charts. And Stephen Few talks about saving the pies for dessert. So here's a simple example. Again, the content doesn't matter so much as the display. This is a pie chart of building permits issued in terms of their value by the Canadian province or territory. And so there's a nice pie chart and a legend. And the first question people ask is, well, I don't really know what these values are. So I'm going to, attach the values so that, because I can't really tell that this is, 3% here and this is 15%. So I'm going to attach a label here with the percentage attached to it. And by the way, the color chart here is really hard to interpret. So I'm going to actually get rid of the legend and just tie the province to the pie slice as well, which is obviously quite helpful because now we can see both the province and the particular data point. But essentially what we've done is we've taken a table of values and we've stretched it around a circle with 13 different colors for something that could be very simply described in a table. And so the creation of a pie chart here does nothing in terms of uncovering, say, big contributors or useful contributors compared to those bigger contributors, as well as a table does in this case. So save the pies for dessert. You can also use a bar chart. That's even more effective than a pie chart because it moves up Cleveland's hierarchy towards the top where best information transfer occurs. And if you're stuck on a proportion of a whole, you just make your axis here go up to 100%. And then you can see what proportion the bar consumes out of that entire 100% range. A second tip for visualization is designing components for message clarity. And for Star Trek fans, this is, the tip here is that make sure that your data stands out. And so you're trying to reduce things like non-data ink. So here's a good example where you can see on the left-hand side, there's significant shading, bolding, some hard colors to look at there in the red. The grid lines are really dark. And so this is really about getting rid of things that are not data. So imagine if you were creating this by hand, the left-hand chart, you'd be pushing down on your pencil or marker really hard. You'd be taking a red pencil crayon, shading it in. When we were kids, we had to build these things by hand, right? We didn't have electronics to do it automatically for us. We would never build a table like this on the left if we were doing it by hand. Certainly, we'd move closer to something on the right-hand side. You want the data to stand out, not the way you've tried to highlight that data. So you want your borders and grid lines to be consistent. You want them muted. You only want them where they're needed. So you can see here we've underlined the title and prepared us for the total. No backgrounds, no pictures, no logos. These are all examples of non-data ink. You also want your graphs to be readable. So you want to avoid caps locks in your titles. You want a title. Subtitles and labels should be muted again. Try to avoid acronyms, jargon, thick, heavy fonts. Here's an example of avoiding 3D, right? This takes us down Cleveland's information hierarchy, information transfer hierarchy, right? And so you want to convert your 3D graphs into something that's at least, back down to 2-dimensional. And here we haven't solved all the reduction non-data ink. We still have shaded background here. Our grid lines are about as thick as our data lines here. And so again, we can improve on that a little bit better by, getting rid of the shading, getting rid of the grid lines. And now the patterns, the relationships start to jump out. And again, if you recall our keynote speaker this morning, Dr. Karan, she had some great line charts and Pareto charts that eliminated a lot of that non-data ink. A very simple example in a Pareto chart or a bar chart where you're trying to look at, dominant categories. The default settings are often for the labels to fit into the graph. If you simply rotate the design of the graph, the reading of the labels becomes much simpler, and you're not asking the reader to do, these, to really throw their neck out trying to read your graph. So very simple choices around transposing the value and category axis can make a big difference in terms of helping your reader interpret. Use subtle colors and use color subtly are two other tips in graphically displaying data. So I kind of call this the Microsoft versus Apple approach, right? Microsoft would use hard colors that hurt your eyes. They're dark, bright, whereas the Apple approach is kind of that muted, smooth view of color. And so that's my general tip around using color. In the course that I teach at McMaster, I penned this as the worst bar plot ever. I, however, have not scanned the literature to verify that claim, but certainly from my perspective, it's the worst bar plot ever. It's a set of bars that actually represent a point in time. So each one of those colors represents a different month or week. And you can see the colors here are they're not muted at all. They're very dark, solid. You've got a shaded background. You've got grid lines that interfere with our ability to interpret. And so any data that's plotted over time is best plotted on a time series plot. And so one way to both eliminate kind of all these colors, which is really trying to differentiate between the categories, it's very difficult here to pick up patterns, relationships. And so using things like small multiples, which is really here now a run chart plotted over time, you can start to see, which of these categories is improving. If down is better, if you use the same y-axis scale, you can see on a order of magnitude which categories are performing better than others, which have less variability than others. These all generate theories, right? Why? So we can start asking why now of these patterns that we're seeing. Just close to wrapping up here. So be a zero hero. If you're using a bar chart, obviously you want to start your y-axis at 0 because, again, Cleveland's hierarchy would suggest that if we build a bar chart in this manner where the axis does not start at 0, we're comparing length here. We very rarely follow the line over to the axis here. We often just look at the difference in the size of the bars. And so in order for us to do that, we need to start that graph at 0 so that we're comparing relative lengths correctly. So in summary, for data visualization, save the pies for dessert, let the data stand out, maximize readability, use subtle colors and use color subtly. Remember that, in our theme of equity, we do have colorblind readers of our charts. And so there's certain color combinations that aren't helpful for our readers, and then be a zero hero.